Infant brain damage can result from unforeseen accidents, though it more typically happens due to preventable incidents or medical negligence. This kind of damage can result from a traumatic or acquired injury. A traumatic injury happens when an external physical force strikes or puts pressure on the baby's head. Examples during birthing include when the baby's head gets stuck in the birth canal, or the doctor uses forceps or birth assistance tools with too much force on the infant's head. Acquired injury occurs when the source of the brain injury is inside the brain or skull. Approximately 2 to 10 of every 1,000 live births suffer from oxygen deprivation, otherwise known as birth asphyxia. If a newborn is deprived of oxygen, physicians only have a small window of time to treat the problem. Asphyxia can cause lifelong brain damage, autism, cerebral palsy, impaired vision, and other disorders. The two types of birth asphyxia are hypoxia, when the baby gets deprived of a significant amount of oxygen, and anoxia, which is a total lack of oxygen. While hypoxia only causes mild to moderate brain damage, anoxia leads to severe brain injuries. In extreme cases, it can cause complete organ failure or death. Both hypoxia and anoxia can cause cerebral palsy and other disorders. Both forms of oxygen deprivation at birth can be caused by a multitude of reasons. A twisted, knotted, short, or prolapsed umbilical cord can cut off a baby's oxygen supply. If it gets wrapped around the baby's neck, a doctor only has a brief time to unwrap it before deprivation occurs. If a baby gets stuck in the birth canal and there is a delay before medical intervention, the baby can experience oxygen deprivation. If labor is complicated or prolonged, the supply of oxygen-rich blood to the brain can be substantially diminished. A ruptured uterus can cause a pregnant woman to lose considerable amounts of blood, which results in a reduced flow of oxygen-rich blood to the baby. Oligohydramnios is a pregnancy complication caused by low amniotic fluid levels. The condition increases the risk of umbilical cord compression, which can cut off the baby's oxygen supply. It can also cause the infant to inhale a mixture of meconium and amniotic fluid into the lungs, further worsening oxygenation problems and respiratory distress. Errors in administering anesthesia can cause blood pressure problems in the mother. If the mom's blood pressure is too low, it decreases the amount of oxygen-rich blood circulating to the baby. Mucus lodging in a baby's lung can constrict their airways. If the uterus and placenta separate rapidly, called placental abruption, the baby can suffer oxygen deprivation. Preeclampsia and Eclampsia results in high blood pressure that can constrict or damage blood vessels in the placenta and also increase the risk of placental abruption. Premature rupture of the membranes, known as PROM, can occur if the water breaks before the mother goes into labor, causing umbilical cord compression and prolapse or even premature birth. This causes oxygen deprivation since the infant's lungs have not fully developed. Certain maternal infections of a pregnant woman can find their way to the fetus, especially during delivery, including infections such as herpes simplex, rubella, and cytomegalovirus, chickenpox, group B strep, GBS, meningitis, and sepsis. These infections can cause premature birth, increasing the risk of a baby's brain damage and cerebral palsy. Fortunately, many are preventable by administering antibiotics, ensuring quick vaginal delivery, or performing a C-section. Physical trauma during labor and delivery can also cause brain damage. For example, if a doctor pulls the baby too hard, injuries including brain damage may result. Improper use of birth-assisting devices such as forceps and vacuum extraction can cause brain damage and other injuries. When infants are not in the head-down presentation at the time of birth, they are at high risk of suffering brain bleeds, umbilical cord problems, and head trauma. When the placenta grows extremely low in the uterus, known as Placenta Previa, it can block the cervix, which can result in severe bleeding and consequential brain damage if vaginal delivery is attempted. An extended delivery period can cause brain damage, especially if the baby's head becomes constantly pushed and knocked against the mother's pelvic bones. Infant hypoglycemia happens when a baby's glucose levels drop, which can occur if the mother undergoes an exhausting labor and birthing process. Infant hypoglycemia is common in premature births, infants with low birth weight, overly large infants, and when the mother suffers from diabetes. The prognosis for newborn brain damage depends on how severe the injury is, as well as other health factors. Brain injuries that are identified and treated immediately greatly improve the prognosis for a baby's survival. While brain damage can result in autism, ADD, and other disorders, children suffering from these disabilities can still lead productive lives, especially if they undergo occupational and physical therapy right after the injury. As a parent, you can leverage your experience and insight with the injured child to help health professionals formulate a more personalized treatment plan. That makes it crucial to understand and recognize distinct types of infant brain injuries as soon as possible. Keep in mind that you're not alone. You can find abundant resources to help you learn more about causes of infant brain injuries, treatments, and more at birthinjurycenter.org.